Good morning, I'm Peter Orszag. I'm sorry I can't be with you in person, but I'm glad we were able to make this video option work. It has been 6 years since the Affordable Care Act was enacted, and in that time there have developed some surprises, which is what I wanted to talk about. Some surprises, some things we should have expected. You have a cheat sheet on the first slide of what I'm going to cover, but basically, relative to what was expected at the time of enactment, employer-sponsored insurance has held up much better than anticipated. Medicare Advantage has thrived despite the predictions that it would collapse or at least shrink dramatically. The cost deceleration, especially in Medicare, has been much larger than could have been expected at the time. And that in turn has resulted in a significant improvement in the long-term fiscal gap, again, bigger than expected at the time. The research since 2010 has suggested that post-acute care represents a surprisingly large share of where improved value could arise in healthcare, and I'll talk a bit about that. And then finally talk about why the political views about the Affordable Care Act have not responded in the way that one would have expected based on previous legislation. So let's dive into this. The first point is that, as the chart shows, employer-sponsored insurance in particular has held up remarkably well despite fears that it would collapse following the Affordable Care Act's enactment. The other thing that's been interesting is that other coverage, that is off-exchange coverage, has not declined as rapidly as one might have expected. And the result of those two forces has been that the exchange coverage has not been as large as initially anticipated. That in turn is then leading, along with issues involving risk adjustment and the rules surrounding the exchanges, to noticeable concerns today about pricing and sustainability on the exchanges. But I note that part of the issue is the silver lining, or a good thing, which is that the collapse of the employer-sponsored world that some people had feared has not occurred, and that means that there are few people moving on to the exchanges relative to what had been anticipated. But the net result, a reduction in 2015 of the number of uninsured people, is basically on target. It's just the mix is different than was initially anticipated. The other big surprise is that at the time of enactment, because the Affordable Care Act reduced the subsidies to Medicare Advantage relative to fee-for-service Medicare, it was anticipated by the Congressional Budget Office and others that there would be a significant decline in Medicare Advantage enrollment. Instead, we've seen a very substantial increase, with almost a third of Medicare beneficiaries at this point being on Medicare Advantage, despite those Affordable Care Act payment reductions. And I anticipate that this trend will continue. I think one of the things that we got wrong in 2010 on this point was a cohort effect. Beneficiaries are increasingly likely to have been exposed to managed care throughout their working careers, and when they go on Medicare, they're therefore more open to a managed care environment as provided through Medicare Advantage. Another big surprise is what's happened on the cost side. So you can see here that pretty much across the board, costs have decelerated dramatically. I would say that if I had stood up when I was director of the Office of Management and Budget and said that I thought that real Medicare spending per person would decline between 2010 and 2015, I would have been laughed at. This chart shows you the data through 2013, but the deceleration has continued. I'd also note that the debate over what's causing this, I think, is off place. In particular, the debate over how much of this is cyclical. The evidence suggests that the majority of the deceleration in Medicare is not cyclical. If anything, none of it is cyclical. And yet, within private insurance, the role of the business cycle is much larger. And so this never-ending debate about how much of the deceleration was due to the great financial crisis, I think, really misses the point that if you focus on Medicare alone, that deceleration cannot be explained by the recession. And that's why I think the Medicare trend is the most interesting phenomenon, because it's not conflated by the business cycle. One of the interesting phenomena is that the employer-sponsored insurance deceleration seems to be driven almost entirely by the business cycle, that is the deceleration, which then leaves no room for all the plan changes that have gotten so much attention. We hear a lot about rising out-of-pocket spending and rising deductibles. It is true that deductibles are increasing, but what's also true is that the out-of-pocket share, even in employer-sponsored insurance, let alone total healthcare spend, does not seem to be rising. And I believe the reason for this is that you have two phenomena going on. One is deductibles are going up, but on the other hand, basically all employer-sponsored insurance coverage at this point has some out-of-pocket limit, which was not true 5 or 10 years ago. And because healthcare costs are so concentrated, don't forget the top 25% of Medicare beneficiaries account for 85% of spend, for example, that out-of-pocket limit, the existence of it, balances the fact that deductibles are going up. So for most people, it's true that out-of-pocket share is going up, but for most dollars, it does not appear to be true. And that's one way of squaring the circle on the fact that employer-sponsored insurance, the deceleration seems to be driven almost entirely by the business cycle. On net, there's very little impact from the plan design. The result of the Medicare deceleration, which again does not look like it's driven by the business cycle, has been a fairly substantial revision in projections of Medicare and Medicaid spending from the Congressional Budget Office, almost 1% of GDP, 0.75% of GDP in terms of the projected spend in 2020. This is a very large revision relative to the projections immediately following the Affordable Care Act. And again, it reflects this ongoing deceleration, which I would note, despite perpetual fears that it's about to end, has persisted through this summer. The most recent data suggesting that Medicare spending per beneficiary this fiscal year is up 4% nominal, which means if you take out inflation and you take out beneficiary growth, it is again either flat or slightly down on a real per beneficiary basis. Now, one of the obvious questions with all of this is whether that deceleration will impose harm on beneficiaries, and that's why the recent evidence, I think, pointing the way towards where some of the inefficiencies are is particularly interesting. We are all familiar with the Dartmouth Atlas, the data on variation in cost per beneficiary across the United States. What's new is an Institute of Medicine report that shows that something like 73% of that variation is in post-acute, that is outside of the hospital, not in acute care, vastly disproportionate to the share of total spending that comes from post-acute care. And that, in turn, is interesting because there is admittedly very preliminary evidence suggesting that that's also where the correlation between spending and outcomes is the most deeply negative. A quasi-randomized experiment using ambulance referral regions suggests that there's a positive return, at least in terms of mortality, from high-spending emergency rooms, but that after you exit the emergency room, and in particular as you enter the post-acute space, the return on additional dollars is deeply negative, and that can help reestablish the old Dartmouth flat of the curve finding because of basically a positive return from emergency room spending, but then a deeply negative return from post-acute spend. And what's interesting again is post-acute is where most of the variation in Medicare is occurring. And one dimension of this is the readmission rate, which you can see here in Medicare, has been declining. It's still too high, but one of the phenomenon that's occurring is that the focus on what happens to people after they leave the hospital is helping to reduce this readmission rate, which there's now at least some financial incentive to reduce because of a penalty on readmissions that was created by part of the Affordable Care Act. I anticipate this focus on post-acute care will continue as the payment system moves, especially towards bundled payments, but also affordable care accountable care organizations, because again, providers that are looking for where they can save money with, while possibly improving outcomes, this is a very natural place to look. And then my final point has to do with why, the classic political economy question, which is, I recognize, a primary focus of this session, Why has the popularity of the Affordable Care Act remained stuck at, depending on what survey you use, but let's just say roughly half the population, unlike what's happened with other pieces of major social legislation in the past? And it was anticipated at the time of enactment that as the Affordable Care Act started to get rolling, its popularity would increase, and yet that really hasn't happened, at least at the top line. Do you support the Affordable Care Act or Obamacare, as opposed to the individual benefits, which do tend to be more popular? And I'd put to you that the big explanation here is just the broader polarization that's been happening in the country, with something that's supported by Democrats being almost reflexively, just automatically being opposed by Republicans and vice versa. You can see this pretty dramatically in the data with regard to voting patterns in the House of Representatives. This chart shows you a visualization of how close a member of Congress is in terms of voting patterns to other members of Congress. The blue dots are Democrats and the red dots are Republican members of Congress. And you can see in the late 40s or early 50s, which is in the upper left part of this graph, that there clearly were two parties. But there were plenty of Republicans that were closer to some Democrats than to fellow Republicans, and plenty of Democrats who were closer to some Republicans than to their fellow Democrats. And yet, as you roll forward in time, you see these two blobs effectively separating with no middle. And that's an environment in which, again, some people are just going to be almost automatically opposed to a policy, and others are going to be almost automatically supportive. You also see the same phenomenon reflected in different metrics. And so one of the key questions is, what's driving this? Is it, if you ask a CNN pundit, they would say most of this is being driven by gerrymandering, and yet the political science literature suggests, even though there's raging debates over what is causing it, that might account for 10 to 15% of this polarization in the House. And so there's something else going on. If you look at county level data, and again, the counties have not been gerrymandered, you see the same phenomenon really coming through quite forcefully. So this is a map of the 1976 electoral results in the presidential election at the county level, and the dark gray or black counties are those where there was a landslide, so a very large margin either for the Democrat or Jimmy Carter or the Republican candidate in that election. And you can see that a large geographic part of the country and a large part of the population are not in those polarized counties. If you roll forward to the 2012 election, you see a much different picture with the vast majority of the country geographically in a polarized county. And it is now the case that the majority of Americans live in a county that landslides in their own direction. I strongly suspect that if we put up the 2016 election map after this election is held, the remaining counties that are not polarized will be fewer and further between. And so this phenomenon of basically growing apart, I think, is one of the major explanations for why the Affordable Care Act is kind of stuck in neutral with regard to its popularity. It's going to be very difficult for deeply red counties or deeply red areas of the country to embrace the Affordable Care Act, and vice versa. The deep blue parts of the country, anything called Obamacare, will be almost reflexively popular. I hope that this changes, and I hope that over time the details where the popularity numbers do tend to be somewhat different, that those come to dominate. But in the meanwhile, I think we're stuck with this sort of polarization phenomenon. So all in all, just upon review, the Affordable Care Act, relative to what could have been expected at the time, I think has turned out much better. We're at the upper part of the tail, especially with regard to the cost trend, which again has been surprisingly good and has led to a fairly noticeable improvement in our long-term fiscal picture, which in turn then opens up the possibility for other types of social investments. It opens up fiscal room for doing other things that we should be doing. Thank you, and I hope you have a great session.